You know, we live in a world now where mental health is really a pretty comfortable thing for most of us to talk about, and that's a great thing. We also live in a world now where access to help for those mental health concerns that you have is easier than ever before. And Charles Miller, who is here this morning with Scenic City Neurotherapy, has been one to come on and talk about what he can do to help people who are struggling with chronic pain, PTSD, anxiety, through your ketamine treatments. And we'll talk about that again this morning, but you kind of want to focus a little bit on this easy access, because maybe now it's becoming a little bit too easy.
Well, so when a while back, the National Institute of Mental Health, former director Thomas Insel, he was quoted as saying that ketamine given IV is the biggest breakthrough we've had in decades. Now, this is something that we've been, putting out there, making sure everybody understands how this works. We work to make this more accessible, we make this affordable. But what we found is that with COVID, there was a restriction that was lifted on prescribing controlled substances at home. And one of the things that came from that was this practice of sending ketamine home with patients for them to self-administer at home. Well, we've had some very unpleasant outcomes that have
and I will say, to kind of let people know this right up front, because I think it's logical to think about people being skeptical, thinking, oh, okay, does he not want people to do that at home because that means they're not coming to him? Not at all, because the truth is it would be easier for you to do your job if that was possible.
If we could do this and still help people get better, this would be a much more profitable model to send it home with people. We could treat more people. We'd just be writing prescriptions all day. It would be so much easier. But at the same time, what we're finding is that the medical supervision is not only necessary just for safety, but for the efficacy of the treatment. It has to be done through an IV to get the benefit. If we could do it another way, we would.
You and I talk on a monthly basis, and so there are things that I know, and I'll forget sometimes that people watching the show might be seeing you and hearing you for the first time. So if that's the case for you, Charles is, you were a nurse anesthetist for years. So your training is there.
Is in anesthesia administration.
So he knows what he's talking about. You had said to me before we began the interview that we live in this world where people think they can watch a YouTube video and do everything. And that's kind of what's happening here. This is dangerous stuff.
It's, unfortunately, even the people prescribing this at-home ketamine component, they're not even 100% familiar with the potential risks and side effects that come along with a rapid-acting anesthetic like ketamine. We monitor patients' vitals continuously. We have a limitation on how many people we can treat at any given time. It's all set up to optimize efficacy, safety, and comfort of the patient. But when we do this correctly, we have one of the most effective treatments for depression, anxiety, PTSD, bipolar, OCD, and the myriad of subtypes that come underneath those diagnoses. But when this is done at home, we have they push this narrative, which is essentially a placebo effect. And they end up having to take higher doses several times a week, which comes with other potential health problems.
Also, something that you do at Scenic City Neuro is it's a requirement, I think, that anybody who comes to you will have to walk hand in hand with a mental health professional. You work in partnership with people.
Right. This is not about getting a medication. This is a treatment process. This is ketamine infusion therapy. Ketamine infusion therapy is not the drug itself. Ketamine is part of the treatment process, which includes mental health providers, which includes preparation before, support during, and follow-up afterwards.
One of the most difficult things, as I understand it, in the mental health world, not from a practitioner's perspective, but from a family member or friend's perspective, is that if it's an adult you're dealing with, all you can do is hope for the best in a way. So are there some warning signs that people might have that somebody is doing this independently and not through you?
I guess they clearly look like they're under the influence of a substance. There are certain things, concepts you'll find online called like microdosing. These things can apply to certain substances, but you cannot microdose ketamine. It doesn't work that way. And they try to apply, what works over here to what we do, and it doesn't work that way.
If there is somebody watching, I have a minute left though, and they perhaps are themselves, they've been doing this, they've been ordering it online, and they're hearing you and they're thinking, oh, okay, I better not do this anymore. What do they do with the ketamine they have? How do they get rid of it?
It is something that you can take back to a pharmacy.
Okay.
And they can dispose of for you. You can send back to the pharmacy that sent it to you in the first place, or to the provider, prescriber.
Okay.
But with, as far as if you have to sit back and say, I think maybe I kind of sort of feel better, but you have to take a dose every day or every 3 or 4 days, then you're just staying sedated. That is a placebo effect.
Correct.
What we do, we're able to, everything we give a patient is out of their system within 2 to 4 hours. But the neuroregeneration that occurs in response, the rebuilding of connections in the brain, that stays for days, weeks, months.
Maybe next time you're here, we can talk again about how that works, because I think it's fascinating what the brain can do if it's being dealt with by somebody who knows what they're doing.
Yes, we should always never sacrifice safety for access.
Okay, so here's where you will find him. It's Charles Miller at Scenic City Neurotherapy on Shallowford Road, 228-0579. We kind of covered this quickly, so if you caught the tail end of it and you're not 100% sure if this might be something to be of concern for you, call his office. But if you're getting your ketamine not through a provider like him, please, please, please be very careful. PhoenixCityNeurotherapy.com is the website. Thanks.
Thank you.